friends, welcome to the Safe Path Veterinary Services. In this video, we will talk about an important disease of the dog, that is the canine distemper disease caused by canine distemper virus. If we talk about an overview of the canine distemper virus and the disease, the canine distemper virus is a highly contagious and often deadly disease. This virus occurs worldwide and is the leading cause of the death in the unvaccinated puppies and dogs. Besides domestic dogs, it also affects the wild carnivores. In a recent study, it is mentioned that this disease is also the cause of death in African lions. The canine distemper virus can affect dogs of any age, but the puppies between the 3 and 6 months of the age are most likely to become ill and die. Older dogs which have never been vaccinated are also very susceptible to the infection, and pregnant mothers can pass the infection to her unborn pups. If we talk about the etiology and transmission, the canine distemper is caused by a paramyxovirus that is closely related to the viruses of the measles and rinderpest. This enveloped virus is sensitive to the lipid solvents and most disinfectant and is relatively unstable outside the host. Infected dogs shed the virus through all the body secretions. Transmission commonly occurs in unvaccinated dogs that come into contact with the infected animals. The main method of disease transmission is by the dog breathing an airborne viral particle emitted by the barking, sneezing, and coughing, or by licking contaminated surfaces. That is the main route of transmission, that is the inhalation or the ingestion route. A dog recovering from distemper can shed the virus for 60 to 90 days after all the symptoms have disappeared. If we talk about the transmission, despite the fact that canine distemper virus are present in many environments, not every dog will become infected. The infection depends on many factors. First of all, that is the host vitality. It means the overall health of the dog, its immune experience, and its vaccination status that will determine whether the animal is going to be infected or it will be protected from the disease. Next is the virulence of the virus, the number of the viral particle in a given area. If the animal is getting the virus dose via any route, then it depends upon the number of virus particles that are entering the body. Next is the other environmental factors that are the stress, dry and hot weather, cold weather, pH. These environmental factors also define whether the animal is going to be infected or it will be not be affected. Though the most important factors seem to be the immune level of the dog and the number of the viral particles the dog is exposed to. If each factor is just right, a dog will become infected. The most important factors are the two, that is the immune status of the dog and the viral particles that are going to enter the body of the host. That will determine if the animal is going to be ill or not. When this occurs, a specific sequence of events is initiated as the virus attacks the body. After the infection, after the animal is compromised to the infection, and then various sequence of events take place within the body of an animal as the virus infects it. If we talk about the pathogenesis, canine distemper virus enters via aerosol route and it has an incubation period of 10 to 14 days when it is replicating and spreading through the body but without any clinical signs and symptoms. Once the organism or the pathogen enters into the respiratory tract, and the virus makes its way to the nearby lymph nodes in the neck, tonsils, retropharyngeal and bronchial lymph node. Virus replication occurs within the lymphoid follicles in the spleen, the gut-associated lymphoid tissues of the lamina propria of the stomach and the small intestine, the mesenteric lymph nodes and the Kupffer cells in the liver. Here the multiplication of the virus particles occur. Widespread virus proliferation in lymph organs corresponds to an initial rise in the body temperature and leukopenia between day 3 and day 6 post-infection. The leukopeniasis means the decrease in the count of the leukocyte, primarily lymphopenia caused by the viral damage to the lymphoid cell affecting the both T and B cells. Once secure within the nodes, viral particles begin replicating and gradually spread through the lymphatic system, generally infecting all lymphatic tissues within the 5 days. The viral particle will infect all the lymphoid tissues of the body just within the 5 days the post-infection. By the 9th day post-infection, the virus has invaded the bloodstream from which it will spread into the respiratory and GI tract and eventually to the CNS. Canine distemper is estimated to be fatal in 50% of the cases affecting the adult dog and 80% of the cases affecting the puppies. The degree of the viremia and extent of the spread of virus to a virus various tissues is moderated by the level of specific humoral immunity and cell-mediated cytotoxicity in the host during the viremic period. If we talk about the various signs and symptoms of the disease in an infected animal, the clinical signs of canine distemper varies depending on the virus strain, environmental condition, host stage, and immune status. Canine distemper causes symptoms in multiple body systems, including the GI tract, respiratory tract, urogenital epithelium, optic nerve, and the brain and spinal cord. Early symptoms during the incubation period within 3 to 6 days of infection include fever, loss of appetite, mild eye inflammation. These symptoms of the early days are usually not noticed and are ignored. But as the disease progresses, there are some specific symptoms that are characterized within the specific systems of the body. With these symptoms, the disease is you can say characterized. If we talk about respiratory signs, these include nasal discharge, usually thick green and yellow discharge, coughing, dyspnea, difficulty in breathing, and pneumonia of the airways. In the GI tract, there is anorexia and vomiting and diarrhea that may be sometimes bloody. Clinical signs of upper respiratory tract, lower respiratory tract, and GI diseases are non-specific, as these signs can be in any condition. A diagnosis of canine distemper should not be made based on these signs alone. Respiratory and GI symptoms are exacerbated by secondary bacterial infection, which is the reason some ill dogs appear to improve their health status temporarily when they are treated with the antibiotics. Thus, these signs, if are very much severe, that may be due to the bacterial infection or maybe due to viral infection. These are signs are not the specific signs for the canine distemper virus. There is an anterior uveitis, that means the inflammation of the front chamber of the eye may cause the cornea to be cloudy or cause changes in the appearance of the iris. The cloudy appearance of the eye, that is also a sign of the you can say canine distemper. There is keratoconjunctivitis sicca, dry eye, optic neuritis, inflammation of the optic nerve may cause sudden blindness. Sudden blindness may be a sign of the with the all other symptoms may be a sign of the canine distemper virus. Retinal degeneration or separation may cause vision impairment. Along with these signs, there is also some dermatological signs which include the pustular dermatitis, in which there are skin rashes associated with the favorable prognosis. There is nasal or digital hyperkeratosis, means there is thickening of the nose and the foot pads associated with the poor prognosis and the progression to the neurological signs. Distemper has sometimes been called hard pad disease due to the hard or hyperkeratized foot pads. Here you can see the different changes in the eyes of the animals due to the canine distemper virus. Here you can see the distemper virus eyes and the hyperkeratosis of the nose of the animals. Here is the puppy. If we talk about the bone lesion in the young growing dogs with experimentally and naturally induced canine distemper virus infection develop metaphyseal osteosclerosis of the long bone. Large breed dogs between 3 and 6 months of the age are most commonly affected. Studies have not shown animals with systemic distemper to develop overt clinical signs related to these long bone diseases. However, canine distemper virus RNA transcripts have been seen in the bone cells of the young dogs with hypertrophic osteodystrophy and metaphyseal bone disease that can be similar to and confused with the metaphyseal osteomyelitis. In this picture, you can see the bone deformity in a dog that is infected with the canine distemper virus. Along with them, there are some neurological signs which may occur in dogs with no or only a mild history of these other signs, or usually occur within 1 to 3 weeks after systemic signs, but may occur at some times or weeks to months later. Once the nervous signs, brain and spinal cord puppies and dogs are infected, the animal usually dies. Once these signs appear, the dog usually dies, and there is a poor prognosis and are highly variable and may include seizures locally and generalized of the any part of the body, but seizure looks if the dog as if the dog is chewing gums and are unique to the distemper. Thus, a convulsion characterized by salivation and often chewing movements of the jaw, chewing gum fits, that is a characteristic signs of the canine distemper virus infection in dog. Generalized signs include the weakness and paralysis, uncoordinated movement, myoclonus, muscle twitching, involuntary contraction, hyperkinesia, that is referred to as increased sensitivity or touch of pain, neck pain or rigidity, vestibular signs that include head tail, loss of balance, or walking in circles, and some behavioral changes are generalized signs of the canine distemper virus. If we talk about the diagnosis, usually at the clinical stage, its diagnosis is made based on the clinical signs, that is the you can say nervous signs, its GIT signs, respiratory signs, and the hard foot pad and the hard nose, the hypercortex of the different regions. These signs are typical signs that refer to the all signs together refer to canine distemper virus. But there is also a rapid test kit of the Biotin company from the Korea is also present for its rapid testing. Other tests include RT-PCR, immunofluorescent assay, serological test, necropsy, and histopathology after the you can say the death of the patient. Other pathological findings include lymphoid depletion is a typical histological finding in dog with systemic illness, thymic atrophy in young dogs, pneumonia and the catarrhal enteritis and rhinitis and inflammation of the tracheobronchial tree is in the infected puppies, meningiocongestion, ventricular dilation and increased cerebrospinal fluid pressure resulting from the brain edema is an acute encephalitis, epididymitis and orchitis causing decrease in spermatogenesis, prostate fluid, and testosterone that occur in the recovering animal. Inclusions can be made in the nucleus or cytoplasm of the astrocytes, mostly intranuclear, and neurons, mostly intracytoplasmic, and it contains viral nucleocapsids and heat shock proteins. Here is the histopathological sign of the canine distemper virus. If we talk about the treatment, there is no specific treatment for the canine distemper virus, but we use the sportive treatments to cover the bacterial infection and for the recovery of the animal, and other symptoms can be you can say controlled via this sportive therapy. In this condition, we use the fluid therapy to elevate the dehydration and to recover the electrolyte loss. And antiemetics can be used to control the MSs that are being the cause of electrolyte loss and the dehydration. And nebulization expectorant can be used for the pneumonia. Seizure may be needed to control by anti-seizure medication, phenobarbital for maintenance prevention, and parenteral diazepam. For the status epilepticus, primidone or potassium bromide are alternative choice. Antibiotic therapy, there is the broad spectrum antibiotic therapy are used for the secondary bacterial infection. Antibiotics that with very good activity against Bordetella bronchosepticum and mycoplasma that include doxycycline, ampicillin, amoxicillin, cephridine, tetracycline, and chloramphenicol may also be indicated if the pathogens are suspected or confirmed. Parenteral fluorphenicol might be considered if this is a concern is essential when GI signs are present. Single dose of corticosteroids can be administered in an attempt to control the CNS edema. This can also be administered to overcome the difficulty with their vision and blindness. Even if the dog survives and recovers from the canine distemper, the symptoms and the signs may prolong for a long time. Here you can see some long-term symptoms in a dog with its teeth discoloration. The dogs with some of the more chronic progressive or vaccine-induced form of neurological disease may respond to the immunosuppressive therapy and anti-inflammatory or greater dose of the glucocorticoid. Specific antiviral therapy against canine distemper has not been evaluated in dogs to have antiviral efficacy in vitro. Vitamin B administered also proved helpful in this condition. Anecdotally, intravenous administration of ascorbic acid vitamin C is also beneficial, and vitamin A induced in the infected ferrets also proved to be effective. If we talk about the prevention, there is only one way for the prevention of the disease, that is avoiding the contact of your animal with the other infected animal, and before that you should have your animal vaccinated against the disease at proper time. You can see here the vaccination schedule starts from the age from the you can say neonatal age at the age of 6 weeks, and up to the age of 16 months. After every 2 to 4 weeks, you can say at the age of 4 to 6 weeks, and then 8 to 9 weeks, and 10 to 12 weeks, and then at the age of 15 to 16 weeks, you can administer the dose of the vaccine 4 times, or you can even use it 2 times at the age at this age, with the 2 to 3 weeks of the interval. Then after that you will have to vaccine your your animal after every yearly annual dose of the vaccine is administered after the first you can say vaccination schedule is completed. As with other vaccines, presence of antibodies received from the mother can interfere with the vaccine, so a puppy is not considered fully protected until the final vaccine in this series has been given. You can see here from 6 weeks to 16 weeks, all the 4 doses of the vaccine or the 3 doses of vaccine should be administered to the animal. The final vaccine dose at the age of 16 week is, you can say, very important. If this dose is missed, there may be inefficacy of the vaccine. You should have to administer the final dose most carefully. Because in the early ages there is as the fetus is taking the milk from the mother, then it can interfere, the maternally derived antibodies can interfere with the vaccine status of the animal. Until the vaccination series is completed, the pup or dog is at risk in contact with the deadly disease. You should avoid to take your pet at the certain stages where there is a chances for your pet to contact the disease from the other animals. The use of appropriate disinfectants such as the quaternary ammonium disinfectant and chloroform, less than 0.5% diluted formalin and phenol of 0.75% are effective to kill the canine distemper virus. Further, the contaminated objects can be disinfected with the water bleach solution of 1:30, and sanitation is very important in preventing the spread of an infectious disease. This video is only for the you can say guidance of the veterinary students, and you can consult it. This is the end of our video. For further videos, you should subscribe to our channel and like the video if you found it informative. Thank you very much.